morning, everyone, and good morning, Dr. McCullough.
Good morning.
Well, we're so happy to have one of our favorite guests with us, Dr. Peter McCullough, and you know him well. He's the co-founder with Dr. Harvey Risch of the Chief Medical Board of the Wellness Company. I always love to share and reshare your credentials because you're such a distinguished, I would say the most distinguished. No one is more distinguished, let me put it that way, than you in the medical freedom and cardiology community. Dr. Peter McCullough is an internist and cardiologist in academic practice in Dallas, Texas, and is proud to be part of the Wellness Company. He received his bachelor's degree from Baylor University and then completed his medical degree as an Alpha Omega Alpha graduate from the University of Texas Southwestern Medical School. In addition, he completed his internal medicine residency at the University of Washington, cardiology fellowship, including service as chief fellow at William Beaumont Hospital, and master's degree in public health of the University of Michigan. Dr. McCullough has broadly published on a range of topics in medicine, with over 1,000 publications and 660 citations in the National Library of Medicine. Dr. McCullough is a recipient of the Simon Dack Award from the American College of Cardiology and the International Vicenza Award in Critical Care Nephrology for his scholarship and research. His works have appeared in the New England Journal of Medicine, Journal of the American Medical Association, Lancet, British Medical Journal, and other top-tier journals worldwide. He is the editor-in-chief of Reviews in Cardiovascular Medicine and senior associate editor of the American Journal of Cardiology. He serves on the editorial boards of multiple specialty journals. Well, having said all of that, no one is more positioned, better positioned than you, Dr. McCullough, to comment on the new regime that's coming in, the new administration, and especially the possible hopeful role of Robert F. Kennedy Jr. in relation to HHS. So let's just launch right in with that. How do you see the election results, especially the role of Robert F. Kennedy Jr. in terms of the issues that you've pioneered?
Well, thanks for having me on the program. Just a quick update on the bio. I have relinquished the two editorial positions you mentioned, but I have taken on editor-in-chief of a new journal, the Journal of Cardiovascular Research and Innovation. So editorial responsibilities shifted. But as a member of the academic community, I can tell you we are very excited about seeing Robert F. Kennedy Jr. Nominated for a cabinet position, Secretary of Health and Human Services. That's a huge cabinet position. Over a dozen sub-agencies report into it, including the CDC, NIH, and FDA. He's going to be a welcome market upgrade from Alex Azar and Xavier Becerra, his two predecessors, who are essentially bureaucrats, autocrats. Kennedy is egalitarian. He likes to bring in different viewpoints. He likes scientific interchange. He's going to welcome that. I think he's going to bring the normal processes back to Washington, which are to frame public health issues, bring in the stakeholders and experts, develop a consensus, and then set public policy, which is very different than what happened during COVID, where simply, autocratic decisions were made with no discussion.
Right. Or I actually thought you were going to say kind of one step further, which would also be legitimate, which is it seemed like private sector stakeholders and even private individuals just sauntered in, dictated policy, and then HHS rolled out the policy. Thinking, of course, of the pharmaceutical industry, specifically the vaccine industry, but even people like the Bill and Melinda Gates Foundation, I mean, just seem to be writing our policy prescriptions in the last 4 years. Well, let's get into the details. Do you think he'll have a difficult time being confirmed, or are you foreseeing that there will be a victory there for him?
I think his chances of confirmation by the Senate have been markedly improved by the recent selection of Dr. Mehmet Oz to be the administrator for Medicare and Medicaid services. That is a very large selection, because Mehmet Oz, again, an upgrade over his predecessor, who was simply a kind of a low-level administrator, not physician, now having a physician who has participated with Medicare and Medicaid programs, as I did for decades. He understands these programs very well. And he's a physician leader who'll be respected by the healthcare systems and the body of physicians and mid-level providers out there. And that when Kennedy is under pressure from in the Senate confirmation process, now he has a physician he can rely on and say, you know what, I'm not a doctor, but I would rely on Dr. Oz regarding, a particular issue that deals with healthcare costs or reimbursement or quality of care in the hospital. Two more important nominations we haven't seen yet, and that is the Assistant Secretary for HHS. That's also a physician. And then the U.S. Surgeon General, which is an independent physician, usually considered America's doctors. Now, if Trump is able to secure those prior to the Senate process, now with three strong physicians, Kennedy, I think, will almost assuredly be approved by the Senate, because he'll have such a strong team. He can defer to any one of those individuals for medical expertise, and he can just stay at a high level in terms of his vision to make America healthy again.
Oh, that's interesting. So the strategy is to surround RFK Jr., who's not a physician, not a scientist, by training as a lawyer, with such kind of the case of Dr. Oz, very mainstream credentialed, like formally credentialed, no question, can't be marginalized as a conspiracy theorist, personalities, so that it'll be difficult for the Senate to stand in RFK Jr.'s way. Is that pretty much what you're saying?
That's exactly right. And especially physicians who are very good communicators, right? So Dr. Oz has been on camera so much. How could anybody question his ability to communicate healthcare issues to the country? RFK, very articulate and, considered a visionary leader. So it's a matter of Trump and his team selecting these others. Now, traditionally, the physicians are chosen about 3 months into the new term. Because a lot of these are just kind of bureaucratic pro forma selections. This is different now. The Trump administration has selected several individuals who have, in a sense, he's kind of shaking up what would be, the presidential cabinet because of his strong mandate with the popular as well as electoral college vote.
That's true, but he's also not, with Dr. Oz particularly, he's really, how can I put it? He's putting together a really strategic mix of outsiders and people whom the public has already accepted, right? It's going to be very hard to throw the baby out with the bathwater. I hadn't put that picture together before you described it, but I see the tactical and strategic value. Well, let's talk about these other roles that have yet to be filled at the highest levels. I've got to ask, if you're not at liberty to say, I understand, but I'd like nothing more than to see Dr. Peter McCullough in among the most senior roles in the scientific and medical establishment and government. Is that something you'd be open to? Not that I have a line to the transition, just curious.
I'd be honored to serve, but I'm certainly not at liberty to speak. And not only that, but I wouldn't publicly try to influence such an important selection. So like so many, like you, I feel like I've been in public service now for over the last 5 years, my work in the academic community and as a public figure. So I'd be honored, but respect the process.
Right. Which is, from my experience in government, that's so rare. And it's one of the qualities that people look for when they're tapping people to serve, like discretion, respect for the process, not being, not amplifying their own reputations at the expense of getting the job done, getting everyone in place properly. Well, I will move on then. Let's talk about Surgeon General. Are there people you'd like to see serve in that role? Are you comfortable naming your top choices for Surgeon General?
Well, I think an obvious consideration would be Dr. Joe Ladapo, who's the current Surgeon General of Florida. So he knows the job well for the state. Again, articulate, has been on camera, Harvard trained, MD, PhD, unassailable credentials, former UCLA professor. So, he would be a top consideration. I do think the Surgeon General will be pivotal. And because throughout history, the Surgeon General has been pivotal. 1961, Luther Terry was named Surgeon General. And in the decades leading up to his nomination, the medical community was fully embracing smoking as a common habit among doctors and nurses. Doctors and nurses advertised cigarettes. They were in the back pocket of big tobacco companies, and they would not admit there was a harm to smoking. They would not. And Luther Terry, with no computers, wrote the Surgeon General report on tobacco. His office did 7,000 references. That document was published in 1964. It changed medical history.
Wow.
So a U.S. Surgeon General changed medical history and said, you know what, smoking is bad for your health. And then the medical community had to finally capitulate and say, listen, we've got to stop smoking and we've got to start saving our patients.
Extraordinary. Would you say that's the most kind of distinguished or decisively acting Surgeon General in recent history, or are there others who come to mind that you would really want to?
C. Everett Koop comes to mind, and in his genre, he was assisted by Dr. Dave Janda from University of Michigan. He's one of my alma mater colleagues, and they did tremendous work on injury prevention. So his contributions were, in a different area of public health. But the Surgeon General, by historical standards, is separate and gives a separate medical opinion from the CDC, NIH, and FDA. What we saw in the last several Surgeon Generals was they essentially became a mouthpiece for the other agencies. And the most recent one, Dr. Murthy, do you know what his big initiative is?
No.
To hunt down misinformation. He's not trying to help anybody. His mission is actually to advance censorship and to squelch scientific discourse.
Unbelievable. I remember that, Dr. McCullough. I'm old enough to remember the reign of Everett Koop, and I remember being struck by how nonpartisan his approach was. I mean, I couldn't identify him advocating one way or another politically. It was just about the nation's health, as you said, America's doctor. And I had the great pleasure of meeting Dr. Ladapo and his wife in Massachusetts recently, and what a perfect choice that would be. That, I mean, I would not be happier. What an amazing conversation that you and I, who have been talking to each other for intermittently for 2 years now, as totally marginalized dissidents, along with our friend and colleague RFK Jr., a totally marginalized dissident, are now kind of casually chatting about cabinet picks and who's going to be the Surgeon General. History really is unpredictable. Do you have a kind of larger interpretation of the extraordinary reversal of fortune in a positive way of the kind of dissident community that has been so stoic in trying to save lives and is now in a position to really set health policy?
Sometimes with secular trends, and this can occur in healthcare or geopolitics, one actually gets to some low point, like progressively lower, lower, lower. There's a nadir, and then there's a rocketing out, almost like the stock market going down and going up. So we have a sense that we hit the nadir, and now we're going to be on an ascending course for rapid improvements. And people can think of, a whole series of objectives that could be tackled with this kind of dream team, like elimination of pharmaceutical direct-to-consumer advertising. Like it's not possible in other countries outside of New Zealand. Stop having the CDC advertise vaccines, for instance. We shouldn't have government agencies doing advertising. A broad sweeping review of safety of biopharmaceutical products. My personal view is an immediate market withdrawal of the COVID-19 vaccines. Now, many would say that that's going to take a process of bringing all the stakeholders together, including the agencies, the academic community, the pharmaceutical companies, the foundations, and having everyone see the safety data in the same room, and then having the decision to pull the COVID vaccines off the market. I think it's going to be a momentous occasion when that happens. It should happen early. And one of the reasons why things can happen so quickly is the academic community is completely tethered to the National Institutes of Health. They depend on NIH grants. And if a new leader of the NIH calls a meeting, they have to show up. We're talking the chiefs of medicine or the deans at Harvard and all the major universities, and they're going to have to face the music.
I mean, that would be, a very salutary outcome. Of course, to me, when I hear you say it would take them all in one room reviewing the safety data, I feel very frustrated because, we have a book showing how
Right.
completely, and you've been showing, for 2 years, how completely unsafe, unfit for being put in human bodies this injection is, and the data that we're drawing on is the government's own data, Pfizer's
Right.
own data. So I don't, I guess procedurally it takes people in a room looking again at the data that is now on Amazon or, in your books and on your Substack. But
well, listen, it's not self-apparent to these leaders. It's really not. They continue to take the vaccines themselves.
Oh my gosh.
Your work would, I'm sure, be, highly featured at these meetings because it's been such an assembly of all the, essentially the regulatory documents and the safety dossier on the vaccines. But, I know people in academia, they are having no grand rounds on vaccine safety. They're having no discussions on working rounds. They never document whether or not patients have taken the vaccine. So to them,
what did you just say?
They never, when a patient comes in with myocarditis,
okay,
blood clot, there's no documentation of prior COVID or the vaccines.
Intentionally? I mean, what a lapse of medical practice.
No, there is a complete oblivion. Listen, I have patients who've been to the Mayo Clinic. They're so frustrated and they come to see me. I see the documentation from the Mayo Clinic and other organizations. They never mention the vaccine, nor do they consider the vaccine a cause of an obvious vaccine injury.
That must be a case, Dr. McCullough, of consciously or not looking for what they don't want to find.
Exactly.
Which we've seen thematically throughout the Pfizer documents.
Exactly.
I mean, especially at this point with myocarditis and pericarditis, not to ask the question, did you take a COVID vaccine, seems like negligence to me. Isn't that eventually going to be actionable, in your view, a subject of litigation, this kind of medical negligence?
I hope it would come to that, but that's the reason why people have to be forced to a meeting and see the information, because they are willfully blind. And, even when this is brought up with colleagues, immediately the answer is, I don't want to talk about it. They simply don't want to see the information. They do not want to see or hear about it because they've all taken multiple doses of the vaccine. They've given it to their children, and they can't possibly bear to think that the vaccines could cause harm in their bodies and to their children and their spouses. Believe me, doctors have a big psychological block on this.
And so you're telling me that to this day, when you try to have conversations with medical academics and medical clinicians about the evidence that you have of damage from the COVID vaccine, they literally say the words, I don't want to talk about it?
Yes. And actually, they give me the Heisman. They'll hold out their hand like, they don't want to.
Oh, wow.
Yeah, you just do not want to talk about it. Myself and Nicholas Hulscher from the McCullough Foundation presented an abstract about COVID-19 vaccine deaths at the American Society of Microbiology in Atlanta. This is a huge, medical meeting, 6,000 attendees. We have our poster. This is mainstream medicine. We have our poster there. And, and we stood there and Nick defended the poster. Nick's now a graduate at University of Michigan. And a doctor came up, an older doctor. He was an infectious disease doctor. And he put his hand on his shoulder and he said, I took 5 shots in this arm and I can't lift it now. I can't move my arm. He said, but if they come out with a booster, I'll just take it in the other arm.
What is this? What are we looking at?
This is a state of delusion at this point in time. And I tell you, doctors, he's an example. He volunteered that. He volunteered that. There is a state of mass delusion. It was the same with smoking back in the 1940s and 50s. I can tell you the same thing. Rosenhill presented to the Medical Research Council in the UK that smoking causes lung cancer. They had it nailed down 1949. Medical community denied it. There's no way smoking is safe. Doctors were advertised. Doctors were smoking in the operating room. In The Emperor of All Maladies, written by Mukherjee, who's a Dana-Farber fellow. He won a Pulitzer Prize, by the way, on his first book, that book. He describes a lead surgeon at Johns Hopkins vehemently denying that smoking causes lung cancer. As he was taking out these black cancers out of the lungs of patients at Johns Hopkins, he was smoking himself during the operations. And then in the end, the surgeon himself dies of lung cancer. And he still couldn't come to admit that smoking was the cause of his lung cancer. That's what can happen in medicine, Dr. Wolf. I'm telling you, medical doctors can get these firm, fixed, false beliefs. Those are delusions.
They are delusions. So it almost sounds as if, I mean, I wish I understood this phenomenon better, because it's so irrational, almost magical, right? I mean, it's almost like magical thinking, or like literally the definition of a delusion is a fixed belief that no amount of evidence can change.
That's it.
I mean, that's like a DSM-4, definition of a delusion. But it almost seems from what you're describing as if people in the general public, lay people, somehow listened to us and our colleagues over, the word got out over the last 2 years, and they were able to reason, but the kind of ground zero of the delusional thinking to this day remains the medical and scientific establishment. And I would like to understand the difference. And I wonder if you take the money, or if you're the ones who are supposed to know better. I mean, maybe it's the level of guilt, right? I mean, people who are lay people took the shots because they were told by the authorities to take the shots. So that would be psychologically more manageable, right? I was misled, as opposed to I misled, all my patients. I misled my colleagues. Do you think that's a factor? Like, what would cause this difference in reasoning?
I think it starts out with basically a religion, a vaccine ideology religion that's gone on for hundreds of years now. It goes back to the smallpox vaccination. And the hubris is that medical science can improve the human body, can improve God's creation. And there's such a strong belief there in medicine that all vaccines are good, and they're accepted on faith, just as smallpox was, just with all the complications. People die of the smallpox vaccine. It ultimately got to forced vaccination in the late 19th century. Parents were put in jail if their kids didn't take it. I mean, it was horrible. Yeah. And it led to the Anti-Vaccination League in the UK, mass uprisings in Canada and the United States and across Europe. And that's the history of this. This is the late 19th century. Then we go into polio and complications with the Cutter incident. One of the polio vaccines gave people polio and paralyzed kids.
Oh my God.
It was horrible. So we have this history in medicine that the vaccine ideology goes like this: that the human body is frail, that the brilliance of biomedical science can improve the human body, but the vaccines aren't perfect. So for them to work, everybody must take them without exception. And if some people are hurt, or even if some people die along the way, they have to take it for the betterment of humanity. They have to take it for the team. And there's very little compassion for people who are casualties from a vaccine campaign. And that is the vaccine ideology in medicine. Now, that happened over hundreds of years. And now you take that current ideology, that current religious belief, and feed in fear from the COVID pandemic, and then a huge amount of money through this biopharmaceutical complex. That's what's landed us to where we are right now.
That is really fascinating. I've got to go back and look at the 19th century anti-vaccination movement, because I had a book that literally just referenced it. in about 19th century Britain and the reaction to the first mandated vaccines. And the book was pulped in 2019 due to allegedly two errors that are usually dealt with a errata slip. But now, if what you're saying is that in the 19th century, and I didn't even find this in my research, right? I'll have to go back and see. There were mass uprisings. I know that there was resistance by parents. I know that there were bills in Britain to force people, progressively more draconian, to force people to get vaccinated. That's probably a history that these people want to have erased. Where did you find that history?
Yeah, the best source is a book called Dissolving Illusions by Roman Bistianic and Dr. Suzanne Humphreys. And it gives a blow-by-blow. Everything is cited. Do you know that they cite the medical literature? There was medical literature about the uselessness of smallpox vaccination, that it didn't work, that the smallpox, it was actually fluid gathered from other people's arms or from horses or cows. It was loaded with staph and strep and tetanus and syphilis. So it made people sick by injecting this into the skin. I mean, it was a horrific time. And this is all, I think that's probably the best cited scientific work that exists, Dissolving Illusions, Bistianic and Humphreys. And we have to go back and point to history and point to this dark time. Now, to be fair, the vaccines did over time become safer. But what they point out is all of these diseases went away, not because of vaccination, but because of improved hygiene, living conditions, sanitation, food and water supply. That's the reason, because other diseases went away too, like scarlet fever, like tuberculosis, like all these other conditions. So it wasn't the vaccines that that won the day. It was improved sanitation. But yet, if you go to the CDC website, it'll say that the greatest advance in public health has been vaccination.
So interesting. I mean, in retrospect, obviously, it's better sanitation, water supply, food supply, because we know now that so many of those diseases are carried by overcrowding, bad food, bad water, and so on. I promise this is my last question about this subject, but isn't a vaccine just a delivery mechanism? Like, you can put anything in a vaccine and call it a vaccine, right?
The definition has shifted over time. In theory, we'd present a foreign antigen of some sort, whether it be a protein, live attenuated virus, or something that would produce an antigen, and then the body would perform an immune reaction to it. But for all vaccines, we really don't know how long any type of protection would last. There aren't long-term studies. So it's a bit of a again, taken on faith that you would take a shot when you're 1 year old and have any protection at age 50 from anything. So in reality, the protection for these is probably on the order of about 6 to 12 months. So this whole battery of shots that the kids get, for instance, I'll give you an example, hepatitis B, that's been examined. So these kids get batteries of hepatitis B shots during infancy. When they really need protection, start having sex and getting tattoos and potentially doing IV drugs in teenage years, there's no protection.
That's insane.
Yeah.
And I also just think about, the HPV vaccine, which we used to be told to have safe sex, not take intravenous drugs. I mean, it's a vaccine solution to a lifestyle problem, basically.
Particularly gay and bisexual men, and that's been studied. If any group really needs the HPV vaccine, it would be that group. And because that's where the risks are for anal cancer and penile cancer. And you know what? In that very sexually active group, little or no protection, because HPV has literally many dozens of strains. No vaccine can cover them all, and so it's essentially a waste of time.
This is so tragic. Truly, last question. I'm just so fascinated by the history of this because, it is so. How can I put it? It's like in the history of ideas. It's like the fetish around vaccines started in the 19th century as a fetish, right? Why do you think that there was such a kind of compulsive, uh, obsessive reaction that vaccines would save everyone. We had to, the British Parliament had to pass laws to force vaccinations. Why is there this deified role of vaccines in medical history and medical practice, as opposed to all the other things that have fallen by the wayside or that are actually useful, like sunlight or, good nutrition?
Yeah, I think actually very early on, even Edward Jenner, who's credited for the smallpox vaccine, he became royalty very quickly. Doctors used to administer the smallpox vaccine and make a lot of money doing it back in the 19th century. So, vaccinology has always been linked to a lot of money. It's always been thought that it's more than just helping an individual, that it's for the public good. That's part of the myth, is that vaccines stop transmission. Vaccines don't stop transmission of any organism.
In no way, even me, an English major, can I possibly imagine how a vaccine can stop transmission.
No, and the CDC website, let's say for the polio vaccine, says right on the website, it doesn't stop transmission of polio. And so they don't have a public health impact, because every year for decades, about 2.5% of Americans don't take any vaccines, like the Amish and Quakers and others.
Right.
And they don't have outbreaks of tetanus or diphtheria or polio. So it was sanitation, water sanitation, and food that carried the day. Now that group of people not taking vaccines, according to CDC and other survey sources, is about 10%. Not taking any vaccines.
Wow.
whatsoever. So you're going to see a large control group emerge. 5 studies show now people who take no vaccines, children who are completely healthy, no vaccines, they have better health outcomes than the vaccinated.
And that's exactly the control group that, that Pfizer tried to not have exist by vaccinating the control in their trials. That's going to be very, very interesting. I mean, what we're going to see, like in 5 years, if 10% of the population is healthier than everyone else by not taking any vaccines, will that be a shock to the pharmaceutical industry, or there's no way to know it unless we know who's going to be in power at that time?
Well, their goal would be to, again, eliminate the control group. You and I, our age group, we're supposed to be taking right now influenza, pneumococcal, and RSV vaccines. And we're constantly reminded by our doctors. We're getting texts, emails. We go into pharmacies. Vaccines are always kind of provided free of charge.
Isn't that weird? Yeah.
Yes.
Yeah. I mean, thank God we're not. It's like, I'm old enough to remember that there were no flu vaccines and people got the flu and they recovered. It's just so surreal, the ever expanding potentialities. And now we know that a pharmaceutical company can put anything in a vial, call it a vaccine, and the FDA will wave it through if the relationships are corrupt enough. Well, that's all going to change in the last few minutes that we have together. Or I hope it's all going to change. Can you please talk about the pharmaceutical supply and what, say, an RFK Jr. or new administration can do about that? And lastly, I'd like you to address the possibility of passing legislation to ban direct-to-consumer advertising for pharmaceuticals.
Well, a good reference is China RX, written by Rosemary Gibson. I had a chance to have her on my show. You probably should have her on. She's terrific. She used to be in government public health, and she has laid out the case that America has completely ceded the drug supply, the original ingredients, to China. China controls all of it, even if it's assembled in China or India. It comes from China. And, it's up to HHS and our Department of Commerce to bring it back to America. I think we should have essential generic drugs produced in our country or our protectorates, because the drug supply should be considered a national security issue.
Totally. How is it that you're the first person to actually say this?
Well, it takes independent scholarship and, again, independent thinking on this. I'm greatly concerned. I rely on, over 90% of the drugs I prescribe are generic, blood pressure, diabetes, other conditions, and they could not be managed without these drugs. China controls the entire supply. So I think we should have an initiative to bring it back to America for the essential drugs, to make sure that, our drug supply is safe. Just like we have a strategic, petroleum reserve, we should have a strategic drug supply.
Totally. How is it not obvious that our essential drugs should not be manufactured by our sworn enemies who wish to wipe us out as a geopolitical force? Well, that's a really important book that everyone should read. And
Right,
how do
right. It's a
sorry.
giant lapse. It's a giant lapse. And you know what? The big pharma producing the branded drugs, they could care less about the generics, right? So if they could, they'd have everybody on the expensive branded drugs. And that brings up direct to consumer advertising,
Okay.
which is misleading. It's confusing. Most of it's for orphan drug applications. And the pharmaceutical companies are using acronyms that we don't know. And so they're trying to speak to a very small, rare population who know their acronyms. And it's a giant waste of money. It's all bundled into the drug costs that Americans have to pay. Every other country outside of New Zealand does not allow direct-to-consumer advertising for those reasons. It should be banned. I hope it's high up on the priority list. And that means also our public health agencies should not be drug advertisers. That means no more CDC, FDA, public health service types of advertisements or public health statements regarding vaccines.
Yeah, I mean, if you think about it, it's so shocking that private companies got our taxpayer funded agencies to give them free advertising and to save that money off of their budgets, for their shareholders. It's so corrupt. The other thing that's going to do, getting us in line with the norms of every country except New Zealand, in terms of not allowing direct to consumer pharmaceutical advertising or medical advertising, is it's going to completely change the news media, right?
That's a good point. Tucker Carlson brought this out on one of his interviews, that because the pharmaceutical companies have these advertisements arrangements with the media, they can actually influence the media content. So you can imagine Pfizer, advertising a whole variety of branded drugs could influence them and say, you know what, we don't want to see any type of safety review on our vaccine on your channel.
Exactly. I mean, the media is bought and paid for by pharmaceutical advertising. I know this is not your job to worry about the news media. It's kind of my job to
Right.
oversee what's going to happen with the news media or think about it. But just not being able to tap those millions, if not billions of dollars in advertising, it means that, the CNNs of the world, the MSNBCs, are going to have to find a completely different business model. They'll either have to close their doors if they can't, generate enough advertising from real products that do real things, that don't have the conflict of interest, of this mass amount of money washing over them, or they'll have to create subscription models, or yeah, we're just going to continue to see what we're seeing, which is independent media like your show, and your platform, that tell the truth about everything, including pharmaceuticals, grow and grow and grow in audience and reach. And legacy media, which took the money and people now know clearly don't cover the story, if not actively lie, they are collapsing. So that'll be fun to watch. I'm glad I'm not a legacy media journalist. I mean, that's a blessing in disguise, right? That I got kicked out of legacy media 2 years ago for doing journalism. But also, I mean, let's end by talking about TWC. When media won't make money lying or covering up for corrupt or ineffective pharmaceuticals and medical interventions, won't networks like TWC Health grow? I mean, isn't that a great opportunity?
Yeah, the wellness company now has a huge member database, a large number of subscribers, global company, major source of healthcare in the United States. I'm one of the original founders and chief scientific officer of the company. And I can tell you through its newsletters, its health education, information out there, becomes its own information channel, if you will, nutraceuticals, supplements, telemedicine, an approach that it takes a non-pharmaceutical approach first. which is unique. And at the membership levels are amazing. The top level is under $100 a month. It's free telemedicine as much as people need, free supplements, and free prescription pharmaceuticals from, yes. So this is one of the best values anyone can have as a supplemental for uninsured individuals. I think it's a must, honestly, so they can get access to medicine, especially those with diabetes, hypertension. Most of my patients are older. If they fall into the category of Medicare only and no supplemental, they can get wellness company far more affordable than a standard supplemental insurance. And it's uncorrupted. So we have no influences from big pharma whatsoever. We're just doing the right thing for patients at the right time.
I'm so happy for the success of the wellness company. It was a brave but daunting task you all set yourselves a couple of years ago, and I'm so pleased that people see the value of it. Where do people find you? How do they follow you, Dr. McCullough?
Well, my website's a central source, petermcculloughmd.com. That'll take you everywhere. I have the top doctor account on Twitter of specialists who see patients face to
Wow.
face. I'm number one right now. And
Congratulations.
Courageous Discourse Substack, read by millions of readers a day. We cross post with Daily Clout frequently, and then my talk show, America Out Loud Talk Radio, McCullough Report, Saturday and Sunday, 2 p.m. Eastern, and then I'm on Pulse answering questions. What public health official has had an open mic and answering questions now for, I've gone down on this for 3 years.
Yeah.
I'm publicly answering questions from, all over the world. I've done it on America Out Loud platform. And like you, I've been diverse because I've been trying to fight censorship.
Right.
And so I haven't kept all my eggs in one basket because I know it's so important to bring the world the truth.
Thank you so much, Dr. McCullough. You've saved so many lives. And, as I always say when I talk to you, you've saved my family more than once with your COVID protocols and your spike support. And we're so grateful to you. I know you'll keep fighting the good fight, and I hope that you run something very gigantic very soon out of the White House or the old executive office building. That's my wish. And I'm going to thank you and let you go. Thank you for all you do. Take care.